This program has been adopted into policy and practice across various states in Australia and has been implemented in various hospitals internationally. And the World Health Organization has endorsed it as a key case study for implementing oral health into maternity services. My name is Dr. Ajesh George. I'm a Professor of Interprofessional Oral Health in the School of Nursing and Midwifery at Western University. I'm also the co-founder and director of the Australian Centre for Integration of Oral Health, which is a national centre with partnerships with public dental services and professional organisations across Australia. I grew up in South Africa where I did my schooling, and then I went to India to study dentistry. While working there, I realized I wasn't interested in clinical practice and I really wanted to make a change at a population level. So I packed up my bags and came to Australia in 2001 to do my Masters of Public Health, followed by a PhD. My turning point in my career was when I was doing a postdoctoral research fellowship at a nursing research center, where I realized there was really a lack of awareness and poor oral health literacy in the community about the importance of oral health and its link to systemic diseases. And more importantly, there was a general lack of emphasis on oral health by the medical, nursing, and allied health profession. We're relying heavily on the dental workforce to take care of the oral health of various population groups. So the question for me was, can we get the non-dental professionals to play a key role in promoting oral health and supporting the dental workforce? And that was the genesis of my career and the establishment of our center. I work in the area of integrated oral health care, where we build the capacity of the non-dental professionals to play a role in promoting oral health, particularly around developing oral health training and resources for the broader health workforce, as well as influencing policy and practice. I also work towards capacity building the dental workforce to play a greater role in general health, particularly in areas like childhood obesity and domestic violence. Over the last 15 years, we have developed and implemented the midwifery-initiated oral health model of care, which has been successful in increasing the knowledge and confidence of midwives in promoting oral health and following on improving the oral health outcomes of pregnant women. This program has been adopted into policy and practice across various states in Australia and has been implemented in various hospitals internationally. And the World Health Organization has endorsed it as a key case study for implementing oral health into maternity services. I love this job because it helps me push the boundaries and think outside the box and train all different types of health professionals who have never thought about oral health to really facilitate a paradigm shift in promoting oral health care. And that has really spurred me on to look for more champions to promote integrated oral health care. Well, back when I was growing up in South Africa, I used to be a very active tennis player. I used to play for the country and we used to travel around playing professional competitions across various countries in Africa. But then after moving to Australia, life got in the way, career took importance, but I also injured myself, tore my ACL. So I've had to put my competitiveness in terms of tennis competitions on hold. But now I enjoy playing casual tennis with my daughters, spending time with family and traveling and more, and also working in the back of my house with gardening.